Welcome back, everyone. Building upon the themes discussed by our previous speaker, our next speaker, Ms. Isabel Fangman, will offer a unique perspective in her presentation titled Bridging Gaps, Building Trust, Partnerships for Maternal and Child Health. Isabel Fangman is a research analyst at Indiana University School of Public Health. She has experience working with law enforcement, migrant populations, and youth involved in criminal legal system. At IU, she is managing the project Incarceration 101, which is a national examination of jail handlers, and supporting other projects in the Health and Justice Lab. Her research interests include maternal and child health in carceral settings, pregnancy and reproductive health in juvenile legal settings, and the effect of structural racism on the health of individuals experiencing criminal and legal involvement. Join me in welcoming Ms. Isabel Fangman.
Thank you so much. First of all, I would love to take the time to thank my co-presenter, Dr. Carly Camplain. Unfortunately, she is moderating another panel at another conference that overlapped. But I did want to thank her and acknowledge her for her contribution and dedication to this work. So the title of my presentation, as you can see, is Bridging Health Gaps, Building Trust, Leveraging Community Partnerships for Maternal and Child Health, Spotlighting Indigenous and Incarcerated Populations. So before we begin, I have some conflict of interest slides to go over. As for myself, I am employed at Indiana University as a research analyst, but I have no other financial disclosures to report, and I don't have any non-financial disclosures to report. Dr. Carly Camplain is employed at Lehigh University, but has no further financial disclosures or any non-financial disclosures to report. So to give you an idea of where we're headed with this talk, the first thing I want to do is give a background on incarceration and maternal and child health. I will also talk about the importance of community partnerships in our work. I will also be speaking a little bit about current projects at the Health Justice Lab. The first being our partnership with the Navajo Nation Department of Corrections, and Incarceration 101, a national examination of jail handbooks. I will also talk about future steps and ways that maternal child health professionals can take action. So not many people really think about incarceration in the context of maternal and child health, but fortunately this field has started to expand and more research has started to be done. So when it comes to incarceration in the US, I want to go over a few facts and things that we should know before we talk about maternal and child health. The first being is that the US has the highest rate of incarceration worldwide, and we also administer some of the longest sentences compared to other countries. Additionally, a lot of you hear jails and prisons in the same context, but they're actually two different types of facilities. Jails are used for pretrial detention. They're more designed for a short-term holding facility, usually for people with sentences for up to a year or those who just can't make bail. Additionally, prisons are designed for longer-term stays. People with sentences of a year or more, or those convicted of felonies for the state or federal government. So why do we have such a high rate of incarceration? Well, the war on drugs policies in the 1980s is partly to blame. This exponentially increased the incarcerated population in the US. And along with that came women and their increased involvement in the criminal legal system. Although they represent a smaller portion today, it's still bigger than what we had ever seen before. So whenever we talk about incarceration, it's important to remember that there are social determinants of health that can determine whether or not somebody is healthy during their stay or after they leave prison. Let's talk about an individual and interpersonal level first. So we know that women involved in the criminal legal system tend to have a poor overall health status. They're also more likely to report experiencing trauma, violence, or abuse. And this can also contribute to their higher rate of mental health disorders, including post-traumatic stress disorder and substance use disorder. About 2/3 of women in the criminal legal system have dependent children, and they're the primary caretaker. On a community and built environment level, we know that the jail or prison environment negatively affects health. The stigma of having a criminal record and substance use disorder can really hinder their ability to access housing, employment, and even healthcare. We also know that women involved in the system are exposed to violence in their communities at a higher rate. From a policy and structural standpoint, the first thing to point out is that there are no mandatory healthcare standards in jails and prisons in the United States. And this is very problematic because, like we talked about before, individuals who become involved in the criminal legal system are at a higher risk for negative health outcomes. Additionally, when it comes to women, the carceral system was really designed for the needs of men, not women. We didn't really see women until about the 1980s, and even then their population has not met that of the men. Additionally, alternatives to jail or prisons can be scarce. There are alternative sentencing programs for caregivers that some states have implemented, but other states have been slow to roll them out. Additionally, racism and discriminatory policies are a problem both in public health, as we all know, but also in the criminal legal system. There are sentencing disparities between people of color and white individuals for the same crime. People of color tend to receive a longer sentence. Additionally, the school to prison pipeline is an issue because children of color are more likely to be disciplined in school more harshly, suspended, and then further involved in the criminal legal system. So, as it is no surprise, some women who enter the prison system may enter pregnant. So Dr. Carolyn Sufrin at Johns Hopkins University and her team wanted to look at what happens when a pregnant individual goes to jail. So they started the Pregnancy and Prison Statistics Study, and they surveyed all federal prisons in the federal prison system, and then willing state prison systems, jails, and juvenile justice centers. So they collected aggregate health outcome data. So this could be the number of pregnancies, the number of stillbirths, the number of live births in the facility. 6 jails participated in the sort of jail segment. They wrote a paper on this. And this included 5 of the largest jail systems in the United States. So it's actually a pretty nice sample. When it came to the results, they found that across all 6 study sites, there were 1,622 admissions of pregnant individuals. There were 240 pregnancies that ended in jail. So most pregnancies, we can gather, don't end in the jail. There were 144 live births, and the preterm birth rate was 8.3%. That being said, in some sites, the preterm birth rate was higher than the national average, and in some sites it was lower. Additionally, it is a smaller sample size, so we have to keep that in mind. 32% of these deliveries were C-sections, and there were 33 induced or medical abortions. And unfortunately, 41 pregnancies ended in miscarriage. There were 4 ectopic pregnancies, and there were 2 stillbirths and 1 newborn death. So when it comes to incarceration and pregnancy among Indigenous women, the first thing we want to point out is that very little data exists to our knowledge, and none of it is in the United States. There's also no data to tribal jails. We also know that women who are Indigenous have higher rates of incarceration. They make up a higher percentage of the carceral population compared to the US general population. We also know that Indigenous women are at a higher risk for adverse pregnancy outcomes like maternal or infant mortality and other complications. So a study in Australia actually looked at linked data between correction systems and the health systems, and they looked at pregnancy outcomes among infants whose mothers were incarcerated when they gave birth versus those who were not incarcerated when they gave birth. And they found that infants of women who were incarcerated when they gave birth had a higher risk of preterm birth and a higher risk of low birth weight. And alarmingly, they had over twice the risk of infant mortality. So when it comes to policy and practice on a national level, there are several issues I really want to point out because like we saw before, there is a risk of adverse health outcomes when a mother is incarcerated and gives birth. First of all, there is no mandatory standard of pregnancy care, just like with healthcare standards. And this is problematic because we know that individuals who come into the women's prison system have a higher risk of having a bad pregnancy outcome. Additionally, access to a OB, midwife, or primary care physician can vary. Some jails they're on site and others are outsourced to the community. Additionally, the standard of care for OUD or opioid use disorder in pregnancy can vary across jails. And in some jurisdictions, people don't even get the standard of care. There are also pregnancy-related accommodations that can be an issue. In some jails, women will get a maternity clothing or access to a lower bunk, or in others, people may not even receive these accommodations. Additionally, the medically unsafe and dehumanizing practice of shackling in the prenatal, Perinatal, so birthing phase, and postpartum period is only outlawed in 40 states, including Arizona, but 10 states have not had restrictions. Furthermore, when it comes to shackling, there are exceptions for harm to self, others, or flight, which is controversial. Additionally, there is some breastfeeding and policy support issues. In some jails, women are able to express milk and give it to their families in the community, whereas others, people are not able to express at all. So in Arizona, I wanted to go back a few years and show the landscape. A lot has happened over the course of the past decade or so, but I wanted to point out a couple years because this is some really important stuff. In 2021, Arizona took a very important step in actually ensuring that pregnant individuals have access to what they need. So the Dignity for Incarcerated Women Act was signed into law, and that outlawed shackling during the pregnancy, birth, and postpartum period. It also required that people received adequate nutrition and prenatal care, and it also banned using solitary confinement and body cavity searches on pregnant and postpartum women. And it also mandated 72 hours with the newborn for bonding after birth. And it also implemented new initiatives such as training to correctional staff and housing accommodations. In 2022, NAFCARE was contracted with the Arizona DOC, and they are the ones who provide healthcare in their prisons. And this is just important to point out because some states and jails will use private healthcare corporations, whereas others will outsource to the community. Arizona just happens to use NAFCARE. The U.S. Court Judge Rosalind Silver, in response to an ongoing lawsuit that started in 2012, it's known as Jensen v. Thornell, she ruled that the Arizona Department of Corrections, Rehab and Reentry, or ADCRR, and their health system was grossly inadequate to meet the health needs of individuals incarcerated, male, female. And in 2023, the same judge ordered changes to staffing, solitary confinement, protocols for medical care, and the timing of screenings that individuals received. And Governor Hobbs also signed an executive order creating a prison oversight commission to look at ways in which the jails could be raised, standards could be raised. So this really tells us that we have a unique opportunity to research, implement, and advocate for solutions that improve the health of incarcerated mothers and pregnant people, as well as their children. So what are we doing? Well, although there are so many research questions that we can answer, we wanted to hone in on a couple. The first being, what is the experience of maternal health care access among those who are incarcerated in tribal jail settings? Remember, there's no data that exists on tribal jails. Additionally, we also wanted to look at the pregnancy care policy in jails across the US, and we wanted to see how it varied by jurisdiction. So the first project I want to talk about is a developing project. We actually haven't gotten this project started yet, but I did want to go over what we were doing. So we started a community partnership with the Navajo Nation Department of Corrections, and this had been ongoing 5 years before we even wrote the grant, which we wrote in February, so fingers crossed. And this is really important to the work that we do. We do a lot of community-based participatory action research. And we also know that researching maternal and child health often requires a partnership. So it's very crucial to what we do. There is some initial research. So this would be the initial research on health in tribal jail settings. To our knowledge, no study has ever looked at health in a tribal jail. And for those of you who don't know what a tribal jail is, it is just a jail operated under the jurisdiction of the Navajo Nation or the Hualapai tribe, just any indigenous sovereign nation, and that's just their jail. So this will include questions about maternal and child health and the experience of women incarcerated. So there's more information to come to the future. I wish there was more I could talk about, but that's as it relates to maternal child health, but we just don't have any data yet. So we're waiting to hear back from the grant, fingers crossed. Another project that we've dove a little bit further into is Incarceration 101, a national examination of jail handbooks. So for those of you who may not know what a jail handbook or an inmate handbook is, think of it like a school handbook, but for a jail setting. School handbooks will outline the policy and procedure and resources in a school, It's the same thing for a jail. This is important because this is the policy information that incarcerated people have access to. We want to use this information to understand how this can affect this jail policy can affect somebody's health across all 50 states. So a couple examples of some research questions that we have as they pertain to pregnancy care in jails are pregnancy tests provided and when. Some jails may screen at 14 weeks or others may screen upon entry. We also want to know about access to pregnancy-related healthcare in jails. Is there a copay? Where is it delivered? Are there accommodations for pregnant people who are incarcerated? This could be extra bedding, a lower bunk, maternity clothing, etc. Are there policies in these handbooks outlining giving birth in custody? And are there policies surrounding breastfeeding and pumping? So we're going to use what is called a legal mapping approach. So this was developed by Temple University Beasley School of Law, Center for Public Health Law Research through a Robert Wood Johnson Foundation grant. And this is just a process for screening legal materials and kind of figuring out what the policies are and how they vary from state to state, county to county, or just by jurisdiction. So the first part of this policy is the first part of this project is that we need to define the scope. We have to be very specific. What is our topic and what does it include? The answer to these questions have to be binary, yes or no. So our scope is, does each jail and each jurisdiction, so county, have policy concerning pregnancy care or accommodations in the facility? So when we conduct our background research, we want to look for the gap in knowledge. What is actually out there and what do we need to fill? We'll draft a background memorandum of 5 jurisdictions, so just some counties and summarizing the pregnancy care policies in there. This will help us develop our search and coding strategy, and we'll refine it as we go. So to our knowledge, there's no legal epi study that has actually looked at inmate handbooks as a resource for policy. So when we develop coding questions from this information that we gather, we're going to set and refine our variables. We'll create questions from them. And again, the answers have to be binary. They have to be a yes or a no. And then here are some examples. Does this jail provide neonatal care? Yes or no? And does it perform pregnancy screening? And this is important because we have to really define what we mean by these in a systematic way. And as we continue to refine them, we'll have to go back and recode to make sure we are staying consistent. We'll also collect the law and create what is kind of like a legal text. So this is through implementing our search strategy and refining it. Again, we want to make sure we're implementing that quality control. So in summary, our strategy is to check each website for the handbook. If we do not find a handbook on that website, we will contact the jails via email or phone to request it. If it is possible, we'll follow up on these emails with a phone call or a secondary contact. And if we need to, some jails will require this, or there's just no response, we'll send a records request. So when we code the law, the policy, and the handbook, we're going to read and document what it says. We're not going to interpret it. We're not going to try to figure out what it actually means. We're just going to write down what this policy is saying. And then publication and dissemination is very important. So we're going to publish our findings probably in the legal mapping paper, which is just showing what the policies look like across the state. We're going to pick Indiana specifically for this project. And then we'll create and share data sets of legal information. So it's very important here to note that we won't be sharing the inmate handbooks out of respect for the cooperation of each facility. But we will be creating data sets that are de-identified. You can't link it back to the jail, but it'll just show the variables that we collected. And again, quality control is a very important aspect of this because it keeps what we are doing consistent and sound. So what do we hope to gain from this project? It's great that we're looking at this policy information, but what do we want to do with it? So the first is that we want to create a snapshot of health policy and programming in each jail and each jurisdiction across the US. Ideally, we may only get maybe half of them, but we're excited. So Then we want to map these policies to make sure professionals know what the legal landscape in their state looks like. We also want to inform future research. So this could be looking at handbook policies and measuring health outcomes. Is there do jails with this policy that's available to these people have a higher rate of overdosing, of overdose deaths in this jail compared to jails that don't, for example. Additionally, we want to inform policy information intervention. So we want to highlight what's existing and infrastructure that's already there. We also want to point out where there's some opportunities for growth. Lastly, we also want to present findings to jail administration. And this is when that community partnership comes in. Because when I've talked to some of the administrators on the phone, when they have questions about our project, a lot of them are very curious about how their policy stacks up to those across their state or across the country. So this can also provide them something that they can use as well. And this also just creates opportunities to bring them to the table because we all have a common goal, and that's to ensure the people in their facility are healthy. And this can really facilitate some good partnerships. So future steps, where do we go from here? As maternal child health professionals, I'm sure you guys are wondering, okay, this is great, but what can I do with this information? So I'm glad you asked. So ways that you can take action. The first thing is that you can think about how the work you do can or does affect women in the legal system. And when you're designing and planning program implementation, evaluation, other initiatives, don't leave women who are incarcerated or pregnant people who are incarcerated out of the conversation. Figure out how you can reach this hard to reach population. Additionally, know your state's laws and policies. The ACLU, American Civil Liberties Union of Arizona, is an excellent resource. And learning from those with lived or living experience. So that could be the Marshall Project or the Sentencing Project, just to start. There's so much out there to really understand what that experience is like. So I just wanted to say thank you so much for this opportunity and for listening to my presentation. I love to talk to people about this field. And I look